Once again, good morning to one and all present here. I am Ramya from BCom, and I have taken a great pleasure to welcome each and every dignitary on the stage. I heartily welcome Ms. Kanchan Banerjee ma'am, who is the Secretary of Indian Cancer Society. And I also heartily welcome Dr. Sanchita Chandar ma'am, who is an member of Sri Shankara National Center for Cancer Prevention and Research, Bangalore. And I heartily welcome Professor Aruna H.K. ma'am, the coordinator of Women Development Center. And I welcome Ms. Amarinder ma'am. Thank you ma'am for coming. And I heartily welcome all the faculty coordinators for today's program. And last but not the least, I also welcome all the volunteers from Indian Cancer Society and the members of the Women Development Center. Thank you. Professor Aruna H.K. ma'am will take over the session.
Thank you, Ramya. Welcome to all of you. So you have witnessing the most unique program here, which is a Breast Cancer Awareness Month, and we are in the last day, and we still managed to do that. Thanks to Kanchan ma'am for that. So we pulled it on, and thank you so much, ma'am. So yeah, okay. So I will ask for a proverb. Please tell me, behind every successful woman, please complete it. Okay, so behind every successful woman is a group of other successful women who support her from back. So we have changed it. A woman is a full circle. Within her is the power to create, nurture, and transform. And the best quote I feel is, the best protection a woman can have is courage. So it's always important for us to be equipped always with the courage. So I take the opportunity to introduce about Women Development Center. So we, the women, need to celebrate each day as a gift, as we can multitask effortlessly and don many hats at a time. So Women Development Center has been working to provide a right platform for students to exhibit their skills, to prepare students for excelling in many fields, to build self-confidence and self-discovery among the students. And the WDC also provides to enable professional and personal development through various activities which it conducts for all the students. So WDC, with its dedicated team comprising of faculty members and student volunteers, aims to work towards the following objectives: organize programs for positive physical and mental health, be a facilitator for the financial growth of women from financially challenged socioeconomic background by conducting skill training programs. We collaborate with women organizations and NGOs to help women overcome socio-economic barriers and transform them to be part of mainstream societies. We conduct various activities like debates, discussions, seminars, workshops, walkathon, and theatrical performances to create awareness on different aspects such as health, women's rights, gender equality, etc. And the objective is also to promote every child of this institution to learn self-defense techniques to defend herself from any sort of physical abuse and harassment. So we also organize camps for healthcare checkup, which we did in the previous past. And WDC also creates awareness on gender sensitization to bring change in one's personal attitude and humanity at large. And to meet the objectives which I've mentioned, WDC has over the years has conducted various activities on skill development programs. We have conducted workshops on fabric painting, candle making, jewelry making, mehendi, mushroom cultivation training has happened, stitching and baking classes. Awareness program as one we are having right now today, the walkathon, poster displays and seminars. Self-defense techniques we have conducted from the martial art experts. And we have conducted talks very regularly. This is what we have been doing is on the women health and hygiene by medical practitioners. And prevention of sexual harassment awareness talks has been conducted in the previous years by the legal experts. The motivational talks by women achievers and this is to make you feel so special about yourself. So, and we also have conducted environment awareness programs. So over the years, WDC has seen a steady increase in the number of students enthusiastically participating in all activities organized, and they are immensely benefited. These activities have also enabled them to develop organizational skills, leadership qualities, to be a team member, communication skills, creativity, confidence, self-realization, and most importantly, realize that each girl or woman they come across in life is a precious gift of nature. So today we are here to celebrate ourselves, and so this is one awareness program for you to understand what you are and what is your take-home message from today's talk. So now I give the mic to Ramya to take over the proceedings. Thank you so much. So thank you for coming here in the pink, and the whole environment is looking amazing today. Thank you so much.
Thank you, ma'am. That was a wonderful speech regarding our Women Development Center. I'm very happy to be a part of it. Thank you, girls, for listening till now with patiently. And now I welcome Tamil Selvi ma'am to introduce the speaker.
Hi everyone, good morning. Myself Tamil Selvi from Computer Science Department. On behalf of WDC, I take privilege to introduce our speaker, Dr. Sanchita Chanda. She is a community dentist at the Department of Community Oncology, Sri Shankara National Center for Cancer Prevention and Research, Bangalore. Having completed her BDS from Manipal College of Dental Science, Bangalore, she is now pursuing her MBA in Hospital and Health System Management from BITS Pilani. Her work involves promoting healthy lifestyle choices in the community, especially women, through various health promotion initiatives and facilitate early detection of cancer through improved screening and surveillance programs. Our special areas of interest include oral potentially malignant disorders, then betel quid addictions, and their impact on health and implementation of public health programs. Ma'am, stage is yours, ma'am. Thank you.
Good morning, everyone. Thank you so much for ICS, the Women Development Cell of Maharani Lakshmi Ammanni College, for organizing this talk. What a way to end the month and step into a new month. This is a great initiative. In fact, I think I haven't seen these many shades of pink in a long time, and I'm very happy that women are here to support each other and take care of each other, especially when it comes to health. So yes, Pink October, we've got the introduction. I will begin with giving you a brief introduction about the organization that I'm coming from. It is Sri Shankara Cancer Foundation. It is a not-for-profit organization that started Sri Shankara Cancer Hospital and Research Center. It's a 520-bedded exclusive cancer hospital located in Baswangudi. So we started this hospital because a lot of patients the number of cases of cancer was increasing. They required treatment, but they had either the government hospitals or the other extreme of private hospitals. So a normal middle-class person who had some amount of insurance, for them to attain treatment, or even patients from different backgrounds and remote villages, for them to get treatment, we started a comprehensive cancer hospital which has the best of the facilities, but provides treatment at a very low cost, and to the extent that, in fact, with the generous support of ICS, we have been able to provide subsidized or free treatment to 18,000 cancer patients have been treated either completely free of cost or received subsidized treatment to the tune of 79 crores in the last 10 years. So this is a brief about our institution. So apart from the hospital, we started the prevention and research wing that focuses on precisely what I'm here to do, is to give the society awareness about cancer, and also the fact that it can be prevented, and try to detect it early so that the deaths associated with cancer starts reducing. When we look at numbers, before this talk was announced, how many of you had heard of the word cancer? Okay, that's about 100%. How many of you had heard of breast cancer? Excellent. How many of you have known someone with breast cancer? Yeah, that's about 10% here. So does that reflect the numbers that you're seeing here? Can you see it at the back? So can you, at the back, can you see the screen here? So breast cancer is the most common cancer worldwide. And especially in the urban population, we are seeing that in Indian women, whether it is in the urban population or slowly catching up in the rural population as well, breast cancer is the most common cancer affecting Indian women. Okay, 1 in 29 women. So we are about 100, 150 here. So 1 in 29 women are at the risk of developing breast cancer in their lifetime. These are the numbers that are shown from years of research and years of tracking women who have developed breast cancers in their families. What is the risk? What are the different factors that affected the risk? So a common incident in India that we see is, in the Western countries, cancer is a disease of old age. So just like you have heart disease, you have diabetes, you have blood pressure, cancer is a disease of old age. But in India, we are seeing a lot more young women coming to the hospitals with breast cancer. So we are yet to understand why this phenomenon is happening in India, but that makes it very important for each and every one of you to actually pay attention and understand what you can do, not only in your lives, but also in the lives of your friends, your mothers, your sisters, your cousins. What are the risk factors? So one is age. Like I said, cancer is a disease of aging. So with an increase in age, there is an increase in the chances of developing cancer. The female sex, because breast cancer is related to your hormones. Okay, if you all know, there are certain hormones in our body that play a role in our menstrual cycle, in our ability to reproduce, and in our ability to feed. So these hormones act as fuel for breast cancers. So an abundance of these hormones in the body increases your chance of developing the breast cancer. That is why, by being women itself, your chances of developing breast cancer increase. Did you know, if you can show a raise of hands, did you know that men can also develop breast cancer? Hands? Okay, that's not bad at all. So while men can develop breast cancer, it is a very small amount and it's very rare incidence. But like I said, because of the hormones, women are at the highest risk. Now, the age of menarche and menopause. Menarche is when you start your periods. So if your periods start early, that is when you're 12, 11, 10, and your menopause happens at a later age, that means these hormones that I said act as fuel for breast cancer has been in your body for a longer period of time. So the longer period of time these hormones remain in your body, the greater the risk of developing breast cancers. So age at childbirth. How many of you here can understand Kannada? ಓಕೆ, ವಂಡರ್ಫುಲ್. ಸೊ ಎಷ್ಟೊಂದು ಜನ ಮನೆಯಲ್ಲಿ ಹೇಳಿರ್ತಾರೆ, ಬೇಗ ಓದಬೇಕು, ಮದುವೆ ಮಾಡ್ಕೊಂಡ್ಬಿಟ್ಟು ವಯಸ್ಸಿದ್ದಾಗಲೇ ಮಕ್ಕಳು ಮಾಡ್ಕೊಂಡ್ಬಿಡ್ಬೇಕು. ಎಷ್ಟು ಜನ ಕೇಳಿದ್ದೀರಾ ಇದನ್ನು? ಹಾಂ, ನಿಮಗೆ ಹೇಳಿದಾರಾ ಎಲ್ಲರೂ? ನಾವೆಲ್ಲರೂ ಕೇಳಿಸ್ಕೊಡೋದೇ ಇದು. ಆ್ಯಂಡ್ ವಿ ಗೆಟ್ ಆ್ಯಂಗ್ರಿ, leave us alone, we want to build a career and all of that. But yes, while I completely support our independence to make that choice, there is also some element of fact in why they say that. And the later the age of childbirth, the higher the risk of developing breast cancer. Okay, so research now says that having the first child before the age of 35 is generally good for the mother's health and also the child's health. So age at childbirth is one of the factors. And after childbirth, breastfeeding. Now, all of us are career-oriented women, and we want, even if we have children, we would like to go back to work early. So women tend to not breastfeed for a long period of time. So if the breastfeeding duration is less than 6 months, then the risk of developing breast cancer increases. Lifestyle factors such as we all see in movies or in real life, tobacco use, alcohol. When I say tobacco use, even hookah and other popular vaping and all those popular things that we see are included. So lifestyle factors such as alcohol, tobacco in any form, highly rich food with very little exercise leading to obesity. All those are factors that increases the risk of developing breast cancers. So why obesity? Again, fat cells produce the estrogen hormones that we just spoke about that acts as fuel. So again, more fat, more estrogen, higher the risk of breast cancer. Okay? Hereditary. We all think, how many of you think that cancer is hereditary, mainly hereditary? Okay, that's excellent. So you have to understand that why genetic and hereditary are two different factors. When we say genetic, it means there is a change in your genetic structure that can happen only to you and not get passed on to the next generation, or it can happen and get passed on to the next generation. That is called hereditary. So very small percent, about 8% of these breast cancers are hereditary. And that is linked to a particular set of gene that we call BRCA gene, BRCA. Angelina Jolie, have you all heard of her? So a few years ago, she underwent double mastectomy, and that is, she got both her breasts removed because she carried this gene. Okay, so yes, it can be hereditary, but that is why it's at the bottom of the list. There are all other things that are still in our control. Okay? So what are the symptoms of breast cancer? Do some of you know that any symptoms for cancer? Are you aware about any symptom for cancer? Cough, okay. Lumps, yes. Hair fall is actually a side effect of one of the treatments. That is actually, so I'll get to that. So the symptoms of breast cancer is any lump or thickening or boil-like new entity in your breast. So it may not be just your breast, it can be in the armpit also. So the first thing that you need to understand is the anatomy. Okay, when we get to, I will also tell you that for you to understand symptoms, you should also start becoming comfortable with your body. I think that is probably one of what ma'am was saying about women development cell, that you have to find the strength within you. So you have to also find the strength to be comfortable in your own skin. So stand in front of the mirror and you have to, everybody has Google the anatomy of breast. Okay? You understand that the entire region, including the midline, is part of the breast. And that should be included during your examination. Okay? So what are the symptoms that can come up? So we have the first, any change in the skin texture. Okay, have you all seen an orange peel? Right? So human skin is not like an orange peel. But one of the early signs of breast cancer is that the skin on the breast starts looking like or feeling like an orange peel. Okay, so it could be small dots. It's usually a very smooth surface. So, but there will be a lot of small dots on a small area. So that is one of the signs. Then you have armpit pain. That may not be as prominent because a lot of girls, especially in the early ages, get armpit pain, whether it is because of exercise or change in the hormones. But yes, armpit pain is one of the symptoms. Skin irritation, a lot of itching, redness, or if you see any wound, pus formation, all of that on any of the area on your breast is a symptom, is a sign. Pulled in nipple. So when you stand in front of the, some people have their nipples inverted, that is going towards the inside. Some people have it outward, so coming out. So sometimes what happens is that while it has been inverted throughout their life, it can get pulled out or pushed out. And it could be just one nipple. Okay, that could be a sign of breast cancer. Also the other way around. It may be outward all through the life and suddenly start getting pushed inward. That is inverted. So that is any change in the way the nipple is protruding is a sign of breast cancer. And a visible lump. So a palpable or visible lump, like I want you all to try this. If you have any ball at home, or let's say a nimbe hannu, lemon, go home, put it under the pillow cover of your pillow, okay? And go from one end of the pillow to the other end, okay? So see, wherever there is the lemon, you can actually feel that there is a change in the texture, right? So having a lump in the breast is something like that. It won't be outward. It is not like other cancers that you see in the movies where this lady comes with a big wound in her mouth. This is something that is growing inside of your body, which is why you have to keep looking, keep feeling, and keep monitoring for changes. And lumping or thickening, we spoke about this, and any nipple discharge. So, a lot of you will eventually have kids and you will be feeding them, and I want you to remember this session for an extended period of time, so that is why I'm talking about kids. After you breastfeed your children, you can, if you notice any discharge coming from the nipple, which is not similar to the milk texture, then you have to get it checked. Okay, because there are all these glands around your nipple that produce the milk, and cancer can develop in those glands. So when there is cancer in that, they release a discharge that comes out through the nipples. So that is also a sign of breast cancer. Now, what can you do? So you're all at an age where the relative risk of developing breast cancer is quite low. Okay, so what can you do? You need to know about what are the screening options that you have. While it may not be possible to completely prevent breast cancer, by screening, that is in people who have no signs, who have no problem, we do certain tests. By screening in normal people, you will be able to detect cancer, especially breast cancer, either in its early stage or something called a pre-cancer stage. Okay, so at that stage, treatment can be given, and the extent of the disabilities that is caused can also be reduced. So what can be done? A digital mammography, worldwide, digital mammography is the standard screening procedure. Okay, and this should start at the age of 40 years. In India, because of the facilities, we also say that 50 years is good enough. Okay, how many of your mothers go for an annual health checkup? That's less than 10%, right? How many of you gift your mothers birthday gifts? So here's an idea. The screening, while it may not apply to you, it will apply to all your mothers. Okay? All of us in this room, all our mothers are at a risk of developing breast cancer. Okay? And we all know how hard they work. We have their fights, we have our fights with them, but we all know that they work hard. And a lot of women do not prioritize their health. Okay? If you start helping your mothers to prioritize their health, when you are their age, you will also start prioritizing your health. Okay? So see if you can, this year, when you give them a birthday gift, gift them something related to their health. Gift them, instead of a day out, ask them to get a health checkup done. Tell them that they are important for you and you want them to be healthy, and gift them a health checkup. Okay? So annual mammograms have to begin at the age of 40. So what is a mammogram? It's basically an X-ray of the breast, taken at different angles. So this is a mammography machine in our hospital. And I'm not sure if you can see these white particles here. Can you see it? So while all of this is normal breast tissue, you will see small hard structures that look like stones. Those are called microcalcifications. Now, those are early signs of breast cancer, that there may be a tumor there. So what does this do? This X-ray will be able to identify if there is any small tumor developing anywhere on the breast, because it is an organ inside of your body. And if there is a family history, if somebody, we call it first degree relative, that is any sibling or parent. Okay? So if a child has breast cancer, their first degree relative will become the mother, the parent, and the sisters or the siblings. So if there is a family history of breast cancer, the screening age will be 5 years before the age of diagnosis of the person in the family. So suppose I have breast cancer at the age of 40, my child, if my daughter, should start undergoing screening for breast cancer at the age of 35. Okay? The other is an ultrasound. So at some point you may have seen a scanning procedure that's being done. Even in movies you see it for, for pregnant women, right? Ultrasound scan. So that can be done for breasts as well. So where is it done? In women less than the age of 40 years, and also in women who have dense breast. Okay? That means breast is supposed to be a very supple, like I said, like a pillow. Okay? If it's too hard, like when you use your pillow for a long time, it becomes slightly hard. So if if your breast is slightly thick and hard, it will be very difficult for the X-ray to actually clearly see what is underneath. So they do something called an ultrasound, which supports the mammogram in identifying any lesions. The other is an MRI, that is a slightly higher level scan, and that is done for high-risk patients. Okay, I hope you all know what are the screening procedures, because you all have to go back and tell your mothers about this. Okay, we have a campaign that we do every October, and it's called Each One Teach One. Okay, so everything that you learn here today, you are going to go back and teach one other woman. That's all you have to do. There are about 150 people in this room. If you teach one other woman, that becomes 300 people. 300 women will know about this. Okay? So that's the pledge we will take at the end of this talk. So what is done when, if on any of these screening procedures, if it comes up that there is a slight chance that there may be something like breast cancer, they do a physical examination. So before any mammography or ultrasound is done, doctors will examine the breast and the axilla physically. Okay, they will press and palpate and check. So they will be able to identify if they can find any lumps or changes in the texture based on their experience. Then we go for imaging, that is the mammography, ultrasound, and the MRI that we spoke about. Now, a lump can be anything. Okay, it can be cancerous, it may not be cancerous. So how do you differentiate? We do something called a biopsy. That is, taking a small needle, putting it through the breast, taking a small tissue out of the lump, and doctors will see it under a microscope to see if it has any features of cancer. And that is the final diagnosis. Without that, nobody can say that this is cancer. Okay? That is the actual final test. After that comes the topic of how we inform the patients and discussing the treatment options. Please have a look at this. How many of you have seen in movies that cancer andre mugitu in hodange? Do you all know that there are treatment options that you can live a long time, 20 years, 30 years after developing cancer? How many of you? How many of you believe that cancer means death sentence? Yeah, it's important. I'm glad you raised your hands, because based on the stage at which it is diagnosed, actually, if it's diagnosed in the first few stages, most cancers can be easily treated and people go on to live very healthy, normal lives. Okay? Especially with breast cancers. I'm stressing on this because a lot of women, if they see a lump or abnormality, they don't go to a doctor. One, because ಅಯ್ಯೋ ಏನಿರಲ್ಲ. The second, ಏನಾರು ಇದೆ ಅಂತ ಹೇಳ್ಬಿಟ್ರೆ ಆಮೇಲೆ ಅಂತ. The third is, I don't want to go through all that treatment. Okay, so these three myths we will break. One is that we have broken that it cannot be nothing, it is always something, and it is better to get that something tested. The second is ಏನಾರು ಹೇಳ್ಬಿಟ್ರೆ treatment ಇದೆ. ಒಳ್ಳೆ treatment ಇದೆ. So the earlier stages, you will have a look here, just the lump, where the lump has been removed and replaced with a normal tissue. So the breast is intact. The nipple is also intact. So a lot of women have this body image fear that ಆಮೇಲೆ ಲೈಫ್ ಹೆಂಗಿರುತ್ತೆ, ನನಗೆ ಅಸಹ್ಯ ಅನಿಸುತ್ತೆ, ನಾನು ಹೆಣ್ಣುಡುಗಿ ಅನ್ಕೊಡೋದು ಇನ್ನು ಹೆಂಗೆ ಅಂತ ಎಲ್ಲ. But you can see that treatment options will cater to all of that. A slightly higher level or stage, then the entire breast will have to be removed. Okay? But that is not the end of it. There can be reconstruction done. That means they will remove a little bit of tissue from the back and put it there and reconstruct it to look like a normal breast. Those options are there. At the earliest stage is where they can just make a small cut, remove the lump and stitch it back. So you have different types of surgical options here. So another thing that they will do is, because cancer spreads from one organ to another through a drainage system in our bodies called lymphatics. So because this armpit region of ours has a lot of lymph, cancer from the breast can move into the lymph areas and from there go to different regions. So this is something that we do at our hospital. So if you saw microcalcification on the inside, doctor will not know where is it, how do I remove, because it is seen only on the X-ray. So what will the doctor do, the radiologist? They will put a thin wire and clip this microcalcific lesion here, okay? And during the surgery, the surgeon will remove this much. This can be done during the biopsy or during the surgery as well. This is called wire localization. So these happens at the earliest stages, which is why screening is important. So what are the other options? Earliest stage, it can be limited only to surgery, okay? A slightly higher stage, there may be surgery with a little bit of radiotherapy. Radiotherapy is basically, the people will say, current kortarante. So the first image that comes to your mind is a 1960s or 70s movie where they'll take the bus to Nimhans, they put them on a wooden chair, put all those electrodes and they go shock like that. It's not that current. It's basically your X-ray that you get. If you have had a broken bone, you get an X-ray. It's the same kind of X-ray. The X-ray that you take for imaging takes about 2 seconds. This will be about 20 minutes. What it does, these X-rays are basically energy particles. They go in and they destroy the cancer cells. They make them burst. That is all. So the surgeon will remove all the cancer that you can see with your naked eye. But from radiation and chemotherapy, everything that you can't see through your naked eye, all the small cancer cells that are there are also destroyed. So chemotherapy is just like giving you drips, and these chemotherapy drugs are given on a cycle, and they are also circulate through the body and kill all the cancer cells. Now a lot of women hesitate because kudlu hogate. Two things that I will tell you. One is kudlu hogodu, that has been with lot of research, the number of chemotherapy drugs that cause hair fall have started reducing. Okay, that means there are newer generation better drugs that don't cause as much hair fall. Second, not all chemotherapy drugs cause hair fall. Now, like I said, there are these hormone receptors, right? The fuel that is producing and making this cancer grow fast. To stop that fuel from entering into the breast cells, we give something called receptor blockers. Okay, that's like a door to this room and guards. So the door to this room, people coming in from outside, is the fuel or the hormones. This is full of cancer cells. So if you want the fuel to come in, you stop them with the guards. So that treatment does not cause hair fall. Okay, so the same treatment that is given to one person and the side effects that is caused to one person will not be the same to the other. So please remember that there are very good treatment options for cancer now. Okay, this is our molecular research lab, and when I said genetics, when I said hormones, a lot of those tests, or a lot of those factors are identified after the surgery or after the biopsy. Those cells are put into these machines where they identify whether there is any genetic change, like any of the cancer patient has a BRCA gene, so the next family member should be aware. What are the hormones that are fueling this cancer? All these tests will be done. So that has become a part of breast cancer treatment worldwide now, and that is why, have any of you have heard of personalized medicine Or have you recently seen about 2-3 months ago, there was a new cancer drug in US that 20 people completely destroyed all cancer cells in their body? And any of you read the paper? Yes, those kind of treatments are possible because of these kind of diagnostics. Okay, soon there will come a day where based on each person's genetic makeup, the medicine will also be made only for that person. We're not too far away from that. Okay? So importantly, what can you do? These are all the information that you will go give somebody else. Okay? What is it that you can start practicing from today? One, the most important is practice self-breast examination. You don't have to go to a doctor. You don't have to go ask somebody else to do it. You have to do it all by yourself once a month. Okay? When you wake up in the morning and look at yourself in the mirror, before you look at yourself in the mirror, will you know you have a pimple on your face? Huh? No. It's only when you go see in the mirror that you see a pimple. Right? And if you've never looked at your face in the mirror before, will you know if that pimple is new or old? Will you know? Never. You will not know. Your breast is also like that. Your body is like that. You don't have to have something abnormal going on to be aware of yourself. Okay? Every month, about 5 to 7 days after your period, okay, you have to stand in front of the mirror while having bath with the hands on your hip. Like most teachers, please forgive me, would in a classroom if you are making a lot of noise. Hands on your hips and look at your breasts in the mirror. Is it of the same size? Are both the nipples at the same level? Is there any changes on the skin? You notice all of this. Okay. After that, you put your arms wide like this. And you see if one moves up and the other doesn't. And then you put both hands above your head, like you would in an exercise. You use one palm. So if you are checking your left breast, you use your right palm. Okay? And you don't pinch. You use the tips of your fingers that is shown here. And then you press. You press like this. So sometimes kattuluk buttirate avaga you ask somebody to press, right? So you press like that. So when you press like that, you will be able to notice any lumps that are under your skin. You have to do that starting from your armpits till the midline of one breast. Again, other breast, starting from the armpit till the midline. And go around up to your nipples. Okay? Go around. And express the nipples to see if there is any discharge coming out. Now, you may not have anything. Every month you will check. And you will, yaak madbekappa idu idondu bere late agi hogta ide college ge ಓಡ್ ಹೋಗಬೇಕು ಇದೊಂದು ಬೇರೆ ಮಾಡ್ಕೊಂಡು ಹೋಗಬೇಕು ಅಂತ. The reason I'm telling you this is, like I said, the pimple. If you don't know what is normal, you will not know what is abnormal. One fine day you will have pain, you will see some skin irritation, but you didn't know if you had it all along or not. So know what is normal, be comfortable with your body, practice this every month, and if there is nothing, great. If there is something, always go and show a doctor at the earliest. And this is something that you have to teach not one, but 5 other women. Okay? 5 other women. And it doesn't matter their age. Even if it's your Ajji, who's 70 years old, 65 years old, she's still at the risk. Okay? So you have to teach 5 women how to practice self-breast examination. So this we have already discussed. What can you do to reduce your risk? Now you practice self-breast examination to see if there is any lump or changes in your body. But what can you do to reduce your chances of developing cancer? One is you have to have physical activity. We are all, Uber, Auto, Rapido, everything is 5 minutes away on an app. Dunzo, Zepto, Blinkit, all of that brings everything home. No exercise whatsoever because we're all busy on social media, right? What you can do is at least 150 to 300 minutes per week. You need to have physical activity, whether it's just climbing stairs, okay? But it should be concentrated effort. It should get your heart racing. It is not something that you will do, college nalli ಓಡಾಡ್ದೆ ಅಷ್ಟೇ ಮುಗ್ದೋಯ್ತು. ಇಲ್ಲ. If you're walking from college to your house, that takes 30 minutes, that is considered exercise. Give yourself 30 minutes a day, starting now. Because once you're older, the time that you have will start reducing. It won't be your time. It will be everybody else's time. It will be your employer's time. It will be your family's time. It will be somebody else's time. So make time for you starting from now. Okay? Alcohol, yeah, yes. The worldwide, they say not more than 1 glass, not more than 2 glasses. But staying away from alcohol is the best choice. Avoid tobacco in all forms, whether it's yele adke with kaddi pudi or gutka, pan, hookah, smoking, beedi, all of that, avoid it in all costs, okay? At all costs. And hormone replacement therapy. A lot of these over-the-counter pills that are there for pregnancy prevention or it's usually given sometimes for PCOS. It's better to avoid that, but that is controversial, so we will not go into that. What can you do? One is practice self-breast examination and self-care. That is, give yourself me time. Second is each one, teach one. Okay? That is, each one of you will tell one other woman about mammography. Okay? Ma'am, that's the mammography pledge. The third is cancer survivor support. There will be so many people that you come across at a mall or at a theater who may be breast cancer patients. You may not know. The first thing you need to know is cancer is not a transmissible disease. It does not go from one person to another person. Second thing, should be no stigma associated with cancer. You support women. You support every cancer survivor. And you learn from them, because the courage it takes to fight a disease like that is something that none of us will have until we reach that point. Okay? So these are our take-home messages. So if you wait for a wound to appear, that's how it will come. And at that stage, there is very little any doctor can do. They can do something, but they won't make any promises. Okay? So we will end with this. Early detection does save lives. So each one, teach one. Can you do that? So shall we make a pledge? This Breast Cancer Awareness Month, I solemnly pledge to practice each one, teach one, and support one. Thank you so much. So Indian Cancer Society is distributing leaflets that talk about breast cancer awareness and self-breast examination. Please take it, please carry it home, please give it to your mothers. Okay? There are more leaflets here about other cancers and the cancer hospital and cancer prevention packages. So please have a look at it if you feel so. Thank you so much.
Thank you, Dr. Sanchita Chandra. Ma'am, it was wonderful explanation about the breast cancer. And thank you for your precious time spending with us. And yes, girls, how you liked the session? It was useful? Yes, great. Now we have a question answers round. So if you have any questions, you can ask ma'am. Ma'am is ready to answer the answers. And girls, if you are not willing to answer in the question in the crowd, you can have a question and answer round in private, where only ma'am will be there. So you can ask ma'am personally and go home. No questions?
Hi, ma'am. It was interesting. Sorry, I've got a sore throat. Uh, I just want to know how much of axillary lymph node swelling can ultimately result in cancer of the breast?
So any lymph node can be swollen or can turn up on a scanning test for a number of reasons. It can be an infection, a skin infection. It can be because there is a boil or a pimple coming up somewhere nearby, or if you have sore muscles. If there is nothing prominent on a mammogram or on the breast, but this lymph node swelling is hard, is slightly more characteristic of a malignancy, they will do something called a lymph node biopsy. And that will tell whether there is any associated malignancy or not. But the chances of an isolated only lymph node to be positive for malignancy is 1 in 10. Less than 1 in 10, I'm just giving you a range. That would be the lowest.
What about the lymph node swelling in the breast? Lymph node swelling in the breast.
So you have lymph nodes surrounding the breast, and you have axillary lymph nodes. So if there is any swelling in the lymph node, it depends on the characteristics. So they will say lymph node is enlarged to so-and-so size, node is visible of so-and-so size of this character. It is based on the character that we'll be able to tell whether it's a malignancy or not. Does that answer your question? Yes.
What's the cost of genetic testing?
So genetic testing, it varies. It can start anywhere between 12,000 and go up to 25 to 30,000. It depends on what are the genes that you're looking for. So a genetic counselor, like the one, so in our cancer prevention clinic, we have a genetic counselor who will actually look at the entire family history, who will also look at what are the key, what is the type of cancer that has come in, what are the genetic tests that could be done to correctly identify what are the genes that are affected. So it can be a panel of tests, or it can be looking for one test. So the cost varies. So, but a genetic test is not something that that anybody would suggest for a layman to go get done for themselves. It is something that you have to speak to a qualified genetic counselor who will be able to guide you. It's like going to, I'm very sorry for this crude way of saying it, but if you know you want to buy a TV, okay, and you walk into a chroma store, all the features, and you also know what is the wall size you have at your house, what is the technology that is required. The person is going to ask all of that and then suggest what is the right TV to buy for you. But this is not based on cost. This is based on your health and the associated family members' health. So for a genetic test, what is usually required is the block of tissue from the person who was first diagnosed in the family with cancer. Like they do something called histopathology, where they identify that there is cancer. They will use one of those blocks and sequence it for the genes that are there and see which gene is abnormal. And so the next generation people or the siblings, they will try to identify if that gene is present in the next family members. So that is something that the counselor will decide what is the right thing to be done. But
I have one more question. Just imagine the mother is diagnosed, okay? The child is below 10 years, girl child below 10 years. So if that is the case, we don't know what reason is the factor for the breast cancer in case of mother. So how much a precaution should be taken for the child?
that is an extremely good question. I'm so glad you asked this. So one thing that you can do, so if the mother is still alive and is undergoing treatment and has some sort of the blood or tissue that is available, one thing that they can do is give that for genetic testing, that sample. Okay, if you don't have access to that sample, a genetic counselor can give a written letter, referral letter, to the hospital that did the surgery and that has the histopathology sample, asking it for the genetic testing. So that hospital will give the block, and based on how that block is stored, they will do the genetic testing. Based on that, the daughter's blood can be matched and checked if there is any similar mutation. The second thing that can be done is, after the daughter reaches menarche, that is, she starts her period, regular clinical breast examination once in a year, her pediatrician or her gynecologist can do a clinical breast examination. The daughter should know how to practice self-breast examination. The third thing that is to be done is, other than all the lifestyle factors, that is, control the weight, eat healthy food, eat nutrient-rich food, that is, all the antioxidant-rich fruits, fresh fruits and vegetables, and have physical exercise, avoid all the unwanted substances. And if the mother was diagnosed at, say, 40 years of age, the daughter should start being screened actively for breast cancer at the age of 35, 5 years before the age of the mother's diagnosis. So 35, she has to start undergoing screening, and based on the severity of the mother's illness, it will be either once in a year or once in 6 months. Or it may also be once a year, it will be one type of mammography, and once in 6 months, it may be an MRI or something like that. So it will be once in 6 months a mammography, once in 6 months an MRI or an ultrasound. So the doctors will put it in a combination so that the earliest diagnosis can be made. Does that help?
65 complete actually. So is it advisable to remove the other one also if it is not diagnosis also?
So the idea, right, these days that is practiced is, if there is a healthy normal tissue, you don't remove it unnecessarily. Depending on the type of cancer that she had. So there are, within breast cancer, there are several different types. Okay, so we have, in the hormone type, one hormone may be dependent, or two hormones may be dependent, or three hormones may be dependent, or it may not be on dependent on any of the hormones. And there can be something called ductal carcinoma also. From what you are telling me, it seems like she is on some hormone positive.
Also they did, ma'am. Under armpit also she is diagnosed with that.
Yes, so the chances will be less, but it can never be ruled out. So instead of undergoing a surgery, the doctors would have suggested once in a year to do a bone scan and PET scan.
Yes, ma'am.
Continue doing that. Continue doing that, and the medications that she's on, I think she will be on for 5 years. So she has to continue taking that, because that is what is acting as the security guard at the door for the cancer. But if she has undergone radiation.
Yes, ma'am, everything is completed, so, now under medication.
So there will always be a risk, you can never rule it out, but it's better to always go in for a passive passive procedure than an aggressive one if she's otherwise healthy.
Thank you, ma'am.
Thank you.
This is in case of breastfeeding mothers, if it is improperly fed, okay, and if there's any mastitis, duct blockages and all, that also has to be taken seriously.
It may not in terms of whether it could cause cancer.
Huh.
No, because that is something that happens as part of the normal cycle. But it shouldn't be left in that constant inflammatory state for a long period of time.
Okay.
So what do a lot of women do? That they don't feed from that breast at all. They let it be. They feed from the other breast. So it shouldn't be in that inflammatory state for a long period of time. It has to be addressed. Whether it's hot water fermentation, milking the duct, clearing it, all of that has to be done. Some intervention has to be done. Mastitis has to be treated. If it is there, usually they'll give a round of antibiotics or they give a superficial dressing to clear out the mastitis, but it has to be addressed. It shouldn't be there for a... So cancer is caused because of any chronic, that is continuous long period of irritation to the normal tissues, where the tissues forget how to be normal and they just go berserk and multiply too many, to too many cells and without any function. So any constant irritation can also lead to certain abnormalities. But at the time of feeding, it is not something that you have to worry about cancer as such, but it is something that has to be addressed.
Okay. But even if it is calcified and hardened, obviously surgical intervention is required.
They will do an excision of it. Ductal excision, they will do it.
Thank you.
No, that is not a myth. It is true. Feeding your child for at least 6 months has a protective effect on breast cancer, developing breast cancer. It's not a myth at all. One thing that I do want to say, like how there is COVID vaccines, there are vaccines for another kind of cancer that a lot of women get. It's called cervical cancers. That's the only, or one of the only cancers that develop through viruses. Okay? HPV virus is a sexually transmitted virus, and there is a vaccine for this. So, women, before they become sexually active, so girls over the just after menarche or 9 to 11 years can get HPV vaccine. But it's not that 9 to 11 or 9 to 15 is the only age group. Before any girl becomes sexually active, they can be vaccinated for human papilloma virus, that is HPV virus, that will reduce your chance of developing cervical cancers to 98%. This is the only established fact where, countries like Canada, UK and Australia, where it's become mandatory to vaccinate all girls, like it is for polio in our country, are not seeing any cervical cancer patients at all for years now. In fact, if they see a cervical cancer patient, they take doctors from developing countries like ours to help with the treatment procedures. So please learn about it. Please save up for it. It is slightly expensive. It's 3,000 rupees per dose. But a new Indian make has come out recently, and hopefully that will be more helpful. But please go talk to your parents and get yourselves vaccinated. Okay, it's safe, it's protective, and it is your right.
Yeah, thank you, Dr. Sinchita, so much, and for clearing all our doubts. Now we'll have certificate distribution just as a representation. Just to give away the certificates, I request Kanchan ma'am. And the rest of you will get your certificates after the walkathon. All of you will get your certificates after the walkathon. Thank you so much for staying back. So before we disperse, after the vote of thanks, please stay back. I request Pushpalata ma'am to do the vote of thanks.
ಪ್ರತಿ ಕಾರ್ಯಕ್ರಮಕ್ಕೂ ಆರಂಭ ಹೇಗಿರುತ್ತೋ ಹಾಗೆ ಅಂತ್ಯನೂ ಇದ್ದೇ ಇರುತ್ತೆ. ಇಂದು ವುಮೆನ್ ಡೆವಲಪ್ಮೆಂಟ್ ಸೆಂಟರ್ ಮತ್ತು ಇಂಡಿಯನ್ ಸೆಂಟರ್ ಸೊಸೈಟಿ ಎರಡರ ಸಹಯೋಗದೊಂದಿಗೆ ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ ಅವೇರ್ನೆಸ್ ಪ್ರೋಗ್ರಾಮ್ ಇದನ್ನು ಆಯೋಜಿಸಲಾಗಿದೆ. ಈ ಪ್ರೋಗ್ರಾಮಿಂದ ನೀವು ಇವತ್ತು ಎಷ್ಟು ಉಪಯೋಗ ಪಡ್ಕೊಂಡ್ರಿ ಅಂತ ನಿಮಗೆ ನಿಮ್ಮ ಮುಖಗಳಲ್ಲೇ ಕಾಣಿಸ್ತಾ ಇದೆ. ಯಾಕೆಂದರೆ ಸ್ತನ ಕ್ಯಾನ್ಸರ್ ಅಂದ ತಕ್ಷಣ ನಮಗೆ ಹೆಣ್ಮಕ್ಳಿಗೆಲ್ಲ ಒಂಥರ ಸಂಕೋಚ, ಮುಜುಗರ, ಇದನ್ನು ಹೇಳ್ಕೊಳ್ಳೋದೋ ಬೇಡವೋ ಅನ್ನುವಂಥ ಒಂದು ಸಂಕೋಚ ಇರುತ್ತೆ. ಅದು ಅಲ್ಲದೆ ನಾವು ಮೊದಲು ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ ಅಂತ ಕೇಳೋದಕ್ಕೆ ಭಯ ಪಡ್ತಾ ಇದ್ವಿ. ಮೇಡಮ್ ಹೇಳ್ದಂಗೆ ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ ಬಂದ ತಕ್ಷಣ ಸತ್ತೇ ಹೋಗ್ಬಿಡ್ತಾರೆ, ಅದಕ್ಕೆ ಪರಿಹಾರನೇ ಇಲ್ಲ ಅನ್ನುವಂಥ ಭಯ ಆತಂಕಗಳಿತ್ತು. ಆದರೆ ಇವತ್ತು ಈ ಕಾರ್ಯಕ್ರಮನ ಆಯೋಜಿಸಿದ ಎಷ್ಟು ಉಪಯೋಗ ಆಗಿದೆ ಅಂತಂದರೆ ನಾನೇ ಎಷ್ಟೊಂದು ಹೊಸ ವಿಚಾರಗಳನ್ನ ತಿಳ್ಕೊಂಡೆ. ಅದೇ ವಿದ್ಯಾರ್ಥಿಗಳು ಇವತ್ತು ತುಂಬ ಅದರಿಂದ ಉಪಯೋಗ ಪಡ್ಕೊಂಡಿದ್ದೀರಾ ಅಂತ ನಾನು ಅಂದ್ಕೊಂಡಿದ್ದೀನಿ. ನಾನು ಮೊದಲೇ ಹೇಳ್ದಂಗೆ ಕಾರ್ಯಕ್ರಮ ಹೇಗೆ ಪ್ರಾರಂಭ ಇದೆಯೋ ಅಂತ್ಯನೋ ಇದ್ದೇ ಇರುತ್ತೆ. ಅಂದರೆ ಕಡೆಯ ಹಂತಕ್ಕೆ ಬಂದಿದ್ದೀವಿ ಅಂತ. ಮೊದಲನೇದಾಗಿ ನಾವು ಶ್ರೀ ಶಂಕರ್ ಸೆಂಟರ್ ಮತ್ತು ಫೌಂಡೇಶನ್ ರಿಸರ್ಚ್ ಸೆಂಟರ್ನ ಸೆಕ್ರೆಟರಿ ಆದಂತಹ ಕಂಚನ್ ಬ್ಯಾನರ್ಜಿ ಮೇಡಮ್ ಅವ್ರಿಗೆ ಹೃತ್ಪೂರ್ವಕವಾದಂಥ ಧನ್ಯವಾದಗಳನ್ನ ಹೇಳಲೇಬೇಕು. ಮೇಡಮ್ ಯಾವ ರೀತಿ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಆಸಕ್ತಿಯಿಂದ ಎಲ್ಲ ಪಾಲ್ಗೊಂಡ್ರು ಅಂತ ನನಗೆ ತುಂಬ ಖುಷಿ ಆಯಿತು. ಅದಕ್ಕೋಸ್ಕರ ನನ್ನ ಪರವಾಗಿ, ನಿಮ್ಮೆಲ್ಲರ ಪರವಾಗಿ, ಕಾಲೇಜಿನ ಪರವಾಗಿ ಮತ್ತೊಮ್ಮೆ ಅವ್ರಿಗೆ ಹೃತ್ಪೂರ್ವಕ ಧನ್ಯವಾದಗಳನ್ನ ಕೋರ್ತಾ ಇದ್ದೀನಿ. ಮತ್ತು ಎರಡನೇದಾಗಿ ನಾವು ಹೇಳಬೇಕು ಅಂತಂದರೆ ವೈದ್ಯೋ ನಾರಾಯಣೋ ಅರ್ಹಿ, ಕೇಳೇ ಇದ್ದೀರಾ, ನಿಮಗೆ ಗೊತ್ತೇ ಇದೆ. ಅದರಲ್ಲೂ ನಮಗೆ ಫೀಮೇಲು ಹೆಣ್ಣು ಮಕ್ಕಳು ಡಾಕ್ಟ್ರ್ ಆಗಿಬಿಟ್ರಂತೂ ನಮ್ಗೆ ಎಲ್ಲಿಲ್ಲದ ಸಂತಸ. ಅದು ಮೇಡಮ್ನ ನಮಗೆ ಕರೆಸಿದ್ದು ತುಂಬ ಖುಷಿ ಆಯಿತು, ಸಂತೋಷ ಆಯಿತು. ಮತ್ತು ಇನ್ನೊಂದು ನಿಮಗೆ ಅವರು ತುಂಬ ಎಷ್ಟು ಪ್ರಶ್ನೆನೇ ನೀವು ಕೇಳಲಿಲ್ಲ ಅಂತ ಅಂದರೆ ಎಷ್ಟು ವಿವರವಾಗಿ ಎಳೆಯಾಗಿ ಸ್ತನ ಕ್ಯಾನ್ಸರ್ನ ಬಗ್ಗೆ ನಿಮಗೆ ತುಂಬ ಡೀಟೇಲಾಗಿ ಹೇಳಿದ್ದಾರೆ. ಕಾಯಿಲೆ ಹೇಗೆ ಪ್ರಾರಂಭ ಆಗುತ್ತೆ, ಅದರಿಂದ ಎಷ್ಟು ಜನ ಅದನ್ನು ನೋವನ್ನು ಅನುಭವಿಸ್ತಾ ಇದ್ದಾರೆ, ಮತ್ತು ಅದಕ್ಕೆಲ್ಲ ಏನು ಪರಿಹಾರಗಳಿದ್ದಾವೆ ಅನ್ನೋಂಥದ್ದನ್ನ ತುಂಬ ವಿವರವಾಗಿ ನಮಗೆ ಹೇಳಿರೋದು ನಿಮಗೆಲ್ಲರಿಗೂ ಅರ್ಥ ಆಗಿದೆ ಅಂತ ಅನ್ಕೋತೀನಿ. ಭಯ ಪಡೋಂಗಿಲ್ಲ, ಮತ್ತು ಅದು ನಾವೇ ಹೇಗೆ ಸ್ವಯಂ ಪರೀಕ್ಷೆ ಮಾಡ್ಕೋಬೋದು ಅನ್ನೋಂಥದ್ದನ್ನು ಹೇಳ್ಕೊಟ್ಟಿದ್ದಾರೆ. ಇಲ್ಲಿ ಹೇಳಿದಾಗ ವೈದ್ಯರು ಅಂದ ತಕ್ಷಣ ತಾಯಿಯಾಗಿ, ತಂದೆಯಾಗಿ, ಗುರುವಾಗಿ ಹೇಗೆ ಕಾಣಿಸ್ಕೊತಾರೆ ಅನ್ನೋದು ಗೊತ್ತಾಗುತ್ತೆ. ತಾಯಿ ಯಾವ ಥರ ಮಕ್ಕಳನ್ನ ಪೋಷಣೆ ಮಾಡ್ತಾಳೋ ಹಾಗೆ ವೈದ್ಯರು ಸಹ ರೋಗಿಗಳನ್ನ ತಾಯಿಯ ರೀತಿ ಪ್ರೀತಿಯಿಂದ ಪೋಷಣೆ ಮಾಡ್ತಾರೆ. ತಂದೆಯ ರೀತಿ ಒಂಥರ ಡಾಕ್ಟರ್ಗೂ ವೈದ್ಯರಿಗೂ ಜವಾಬ್ದಾರಿ ಇರುತ್ತೆ, ಕೆಲವು ಅವರದ್ದೇ ಆದಂಥ ಜವಾಬ್ದಾರಿನೂ ಇರುತ್ತೆ. ಮತ್ತು ಗುರುವಾಗಿ ಅಂದ ತಕ್ಷಣ ನಿಮ್ಗೆ ಗೊತ್ತೇ ಇದೆ, ಗುರು ಅಂದ ತಕ್ಷಣ ಯಾವ ರೀತಿ ಮಾರ್ಗದರ್ಶನ ನೀಡ್ತಾರೆ, ಮತ್ತು ಆ ವಿಷಯದ ಬಗ್ಗೆ ಅವ್ರು ಎಷ್ಟು ನಾಲೆಡ್ಜು, ಜ್ಞಾನ ಹೊಂದಿರ್ತಾರೆ ಅನ್ನೋದು ನಮ್ಗೆ ಗೊತ್ತಾಯ್ತು. ಮೂರನ್ನು ನಾವು ವೈದ್ಯರಿಗೆ ಸಲ್ಲಿಸಲೇಬೇಕು. ಆ ದೃಷ್ಟಿಯಲ್ಲಿ ನೋಡಿದಾಗ ಇವತ್ತಿನ ಕಾರ್ಯಕ್ರಮದಲ್ಲಿ ನಮ್ಮ ಡಾಕ್ಟರ್ ಸಂಚಿತಾ ಚಂದರ್ KS ಅವ್ರಿಗೆ ನಾವು ನಿಜವಾಗ್ಲೂ ನಮ್ಮ ಪರವಾಗಿ, ನಿಮ್ಮ ಪರವಾಗಿ, ಕಾಲೇಜಿನ ಪರವಾಗಿ ಹೃತ್ಪೂರ್ವಕ ವಂದನೆಗಳನ್ನ ಸಲ್ಲಿಸ್ತಾ ಇದ್ದೀನಿ. ಮತ್ತು ಮೂರನೇದಾಗಿ ಹೇಳಬೇಕು ಅಂತಂದರೆ ವುಮೆನ್ ಡೆವಲಪ್ಮೆಂಟ್ ಸೆಂಟರ್, ಇದರ ಒಂದು ನಾನು ಕೇಳೇ ಇರಲಿಲ್ಲ. ಕಾಲೇಜಿಗೆ ಬಂದಲ್ಲೇ WDC ಅಂದರೆ ಏನು ಅಂತ ಪ್ರಶ್ನೆ ಹಾಕೊತಾ ಇದೆ. ನಾನು ಅದರಲ್ಲಿ ನಿಜವಾಗ್ಲೂ ಸದಸ್ಯಳಾಗಿದ್ದು ನನಗೆ ಒಂದು ರೀತಿ ಅದೃಷ್ಟ ಅನಿಸುತ್ತೆ. ಯಾಕೆಂದರೆ ಒಂದೆರಡು ಕಾರ್ಯಕ್ರಮ ಅಲ್ಲ, ಪರ್ಫಾರ್ಮಿಂಗ್ ಸ್ಕಿಲ್ಲು ಯಾವ್ಯಾವುದಿದೆ ಎಲ್ಲ ಮಕ್ಳಿಗೆ ಏನೇನು ಕಲಿಕೆಗಳನ್ನ ಆಸಕ್ತಿ ಹೆಚ್ಚಿಸುವಂಥ ಕಾರ್ಯಕ್ರಮಗಳನ್ನ ಕೈಗೊಂಡ್ರು. ಮತ್ತು ಏನೇ ಕೆಲಸ ಮಾಡಬೇಕು ಅಂತ ತುಂಬ ಹುಮ್ಮಸ್ಸಿಂದ, ಎಷ್ಟೇ ಸ್ಟ್ರೆಸ್ ಇರಲಿ, ಆಯಾಸಗಳಿರಲಿ, ಹುಮ್ಮಸ್ಸಿಂದ ನಮ್ಮ ಕಾಲೇಜಲ್ಲಿ ನಮ್ಮ ಕೋಆರ್ಡಿನೇಟರ್ ಆದಂಥ ಪ್ರೊಫೆಸರ್ ಅರುಣಾ ಮೇಡಮ್ ಅವ್ರಿಗೆ ನಾನು ತುಂಬ ಹೃತ್ಪೂರ್ವಕವಾದಂಥ ವಂದನೆಗಳನ್ನ ಸಲ್ಲಿಸ್ತೀನಿ. ಯಾಕೆಂದ್ರೆ ನಿಮಗೆ ಗೊತ್ತಿದೆ ಮೇಡಮ್ ಅವ್ರು ಎಷ್ಟು ಆಸಕ್ತಿಯಿಂದ ಎಲ್ಲರನ್ನೂ ಮಕ್ಕಳನ್ನೆಲ್ಲ ಒಟ್ಟುಗೂಡಿಸ್ಕೊಂಡು, ಅಧ್ಯಾಪಕರನ್ನ ಒಟ್ಟುಗೂಡಿಸ್ಕೊಂಡು ಯಾವ ರೀತಿ ಕಾರ್ಯಕ್ರಮನ ಸಂಯೋಜನೆ ಮಾಡಿದ್ರು ಅಂತ ನಾನು ಇವತ್ತು ಕಣ್ಣಾರೆ ನೋಡಿದೆ. ಅದಕ್ಕೋಸ್ಕರ ನಾನು ಇವತ್ತು ತುಂಬ ಅವ್ರಿಗೆ ಆಭಾರಿಯಾಗಿದ್ದೇನೆ. ಮತ್ತು ನಾವು ಇವತ್ತು ಅನುಪಸ್ಥಿತಿಯಲ್ಲಿ ನಮ್ಮ ಮಹಾರಾಣಿ ಲಕ್ಷ್ಮೀ ಅಮ್ಮಣ್ಣಿ ಕಾಲೇಜಿನ ಪ್ರಾಂಶುಪಾಲರಾದಂಥ ಡಾಕ್ಟರ್ ನಾಗಲಕ್ಷ್ಮಿ BN ಅವರು ಇವತ್ತು ತುಂಬ ಬ್ಯುಸಿಯಾಗಿರೋದ್ರಿಂದ, ಮತ್ತು ಒಂದು ಮೀಟಿಂಗ್ ಇದೆ ಅಂತ ಹೇಳಿದ್ರು, ಅವ್ರಿಗೂ ಬರೋದಕ್ಕೆ ತುಂಬ ಆಸಕ್ತಿ ಇಷ್ಟ ಇತ್ತು. ಆದರೆ ಅವರು ಇವತ್ತು ತುಂಬ ಬ್ಯುಸಿಯಾಗಿರೋದ್ರಿಂದ ಈ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಬರದೇ ಇದ್ದರೂ ನಮ್ಮ ಜೊತೆಗೆ ಇದ್ದಾರೆ ಅಂತ ಅನ್ಕೋತೀವಿ. ಅವ್ರಿಗೂ ಸಹ ನಮ್ಮ ಪರವಾಗಿ, ನಿಮ್ಮ ಪರವಾಗಿ, ಎಲ್ಲರ ಪರವಾಗಿ ಹೃತ್ಪೂರ್ವಕ ಧನ್ಯವಾದಗಳನ್ನ ಸಲ್ಲಿಸ್ತೇನೆ. ಮತ್ತು ಬರೀ ಈ ಕಾರ್ಯಕ್ರಮದಲ್ಲಿ ಪಾಲ್ಗೊಂಡಿರೋದ್ರ ಜೊತೆಗೆ ನಮ್ಮ ಕಾಲೇಜಿನ ಇತರ ಅಧ್ಯಾಪಕರು ಮತ್ತು ಅಧ್ಯಾಪಕೇತರರು ಸಹ ಈ ಕಾರ್ಯಕ್ರಮದಲ್ಲಿ ಪಾಲ್ಗೊಂಡಿದ್ದಾರೆ. ಎಲ್ಲರಿಗೂ ಸಹ ನಮ್ಮೆಲ್ಲರ ಪರವಾಗಿ ಹೃತ್ಪೂರ್ವಕ ಧನ್ಯವಾದಗಳನ್ನ ಸಲ್ಲಿಸ್ತಾ ಇದ್ದೇನೆ. ಮತ್ತು ಇಂಡಿಯನ್ ಕ್ಯಾನ್ಸರ್ ಸೊಸೈಟಿ, ನನಗೆ ಎಷ್ಟೊಂದು ಜನಕ್ಕೆ ಇವತ್ತು ಹೊಸಬ್ರು, ನಾವು ಹೊಸಬ್ರು ಅವ್ರಿಗೆ, ಬಟ್ ಆದರೂ ಗೊತ್ತಿಲ್ಲ ಹೆಸರು ಹೇಳಿಲ್ಲ ಅಂದರೆ ಏನು ಬೇಸರ ಮಾಡ್ಕೋಬೇಡಿ. ಎಲ್ಲ ಸ್ವಯಂ ಸೇವಕರಿಗೂ, ಇಂಡಿಯನ್ ಕ್ಯಾನ್ಸರ್ ಸೊಸೈಟಿಯ ಸ್ವಯಂ ಸೇವಕರಿಗೂ ಸಹ ನಾನು ಹೃತ್ಪೂರ್ವಕ ಧನ್ಯವಾದಗಳನ್ನ ಸಲ್ಲಿಸ್ತಾ ಇದ್ದೀನಿ. ಕಡೆಯದಾಗಿ ಈ ಕಾರ್ಯಕ್ರಮ ಇಷ್ಟು ಯಶಸ್ವಿ ಆಗೋದಕ್ಕೆ ಕಾಲೇಜ್ ಇಲ್ಲದೆ ವಿದ್ಯಾರ್ಥಿಗಳಿಲ್ಲ, ವಿದ್ಯಾರ್ಥಿಗಳಿಲ್ಲದೆ ಕಾಲೇಜಿಲ್ಲ. ಈಗ ನೀವು ಇಷ್ಟು ಹೆಚ್ಚಿನ ಸಂಖ್ಯೆಯಲ್ಲಿ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಬರಲೇ ಇಲ್ಲ ಅಂದಿದ್ರೆ ಕಾರ್ಯಕ್ರಮ ಅಷ್ಟು ಯಶಸ್ವಿ ಆಗೋದಕ್ಕೆ ಸಾಧ್ಯನೇ ಆಗ್ತಾ ಇರಲಿಲ್ಲ. ಅದಕ್ಕೋಸ್ಕರ ನಾನು ಪ್ರಮುಖವಾಗಿ ಯಾರಿಗೆ ಹೇಳಬೇಕು ಅಂತಂದರೆ ವಿದ್ಯಾರ್ಥಿಗಳಿಗೆ, ಇಲ್ಲಿ ಆಗಮಿಸಿರುವಂಥ ವಿದ್ಯಾರ್ಥಿಗಳಿಗೆ ಹೃತ್ಪೂರ್ವಕ ವಂದನೆಗಳನ್ನ ಸಲ್ಲಿಸ್ತಾ ಇದ್ದೀನಿ. ಕೊನೆಯದಾಗಿ ನಾನು ಹೇಳೋದೊಂದು ಮಾತೇನು ಅಂತಂದರೆ, ಸಂಸಾರ ಗುಟ್ಟು ಅಂತಾರೆ, ವ್ಯಾಧಿ ರಟ್ಟು ಅಂತಂದರೆ ರೋಗವನ್ನು ಸಂಕೋಚ ಪಟ್ಕೊಂಡು, ನಾಚಿಕೆ ಪಟ್ಕೊಂಡು ಏನು ಅನ್ಕೋಬಿಡ್ತಾರೆ ಅಂತ ಅನ್ಬಾರ್ದು. ಸಂಸಾರದಲ್ಲಿ ಕೆಲವು ಗುಟ್ಟುಗಳಿರಬೇಕು, ಆದರೆ ರೋಗದಲ್ಲಿ ಮಾತ್ರ ಯಾವತ್ತೂ ನಾವು ಗುಟ್ಟನ್ನು ಇಟ್ಕೊಬಾರ್ದು, ಅದನ್ನು ರಟ್ಟು ಮಾಡಬೇಕು ಅನ್ನೋದನ್ನು ಈ ಒಂದು ಸಂದರ್ಭದಲ್ಲಿ ನೀವು ಮನವರಿಕೆ ಮಾಡ್ಕೋಬೇಕು. ಜೊತೆಗೆ ಡಾಕ್ಟರ್ ಮೇಡಮ್ ಹೇಳ್ದಂಗೆ ಈಚ್ ಒನ್ ಟೀಚ್ ಒನ್ ಮತ್ತು ಸಪೋರ್ಟ್ ಒನ್, ಬರೀ ನಾವು ಕೇಳ್ಕೊಂಡು ನಮಗೆ ಮಾತ್ರ ಸೀಮಿತವಾಗಿರಬಾರ್ದು, ಅದು ಎಲ್ಲರಿಗೂ ಏನಾಗಬೇಕು, ತಲುಪಬೇಕು ಅನ್ನುವಂಥ ಒಂದು ಪಾಠದ ಜೊತೆಗೆ ನಾವಿವತ್ತು ಕಾರ್ಯಕ್ರಮ ಯಶಸ್ವಿಯಾಗಿದೆ ಅಂತ ಅನ್ಕೋತೀನಿ. ಧನ್ಯವಾದಗಳೆಲ್ಲರೂ.
Thank you, girls. Thank you so much for waiting for so much time. And girls, you can take your caps outside and you will be ready for the walkathon.
Let's be aware. Let's be aware. your way.